Welcome to the Medical and Dental channel. This video is part 2 of our cervical screening series. In part 1, we talked about cervical screening tests, cervical cancer, and human papillomavirus. In this video, we'll be talking about when and how a cervical screening test is performed.
My name is Lufi and I'm a medical doctor.
And I'm Leah and I'm a dentist.
We're sisters who are both based in Melbourne.
We believe you deserve to understand your mind and body, so on this channel we discuss all things medical and dental to help you find your way to health and happiness.
So, how is a cervical screening test actually performed?
A cervical screening test is performed in a similar way to a pap smear. It's performed by a GP, a family physician, gynecologist or a nurse in the consulting room. It's a fairly non-invasive procedure and does not involve any needles or an anaesthetic. A cervical screening test should not be painful, but in some women it may be just a little bit uncomfortable. Your doctor will ask you to lay on your back with your feet together, your legs bent and your knees apart. Your doctor will then gently insert an instrument called a speculum into your vagina. This is a vaginal speculum. They come in metal and plastic. Most doctors these days will use a disposable one, like this plastic one. The speculum holds the vagina open and makes it easier to see your cervix. This is a diagram of the cervical os that we showed in part 1 of our cervical screening series. This is what a healthy cervix looks like. Once your doctor is able to visualize your cervix through the speculum, your doctor will then insert a small brush into the vaginal canal, like this, and partially through the cervical os, which sweeps up a sample of cells from the area just inside and around the external cervical os. Being as relaxed as possible will reduce the level of discomfort during the cervical screening test. Avoid holding your breath, as this will actually cause the walls of your vagina to tense up and cause more discomfort. The cervical screening test itself does not take a long time to perform, but your doctor will usually take a clinical history first, and they may also perform other examinations on you before they perform your cervical screening test. So when you make an appointment to see your doctor for a cervical screening test, it's always a good idea to keep in mind that you may need to book in for a longer appointment. How long does it take for cervical cancer to develop?
It usually takes 10 to 15 years for an HPV infection to develop into cancer. So as long as you make sure you have a cervical screening test every 5 years, if you are found to have an HPV infection, it can be managed effectively before it develops into cancer.
So when should you have your first cervical screening test?
It is now recommended that you have your first cervical screening test from the age of 25 years if you have ever been sexually active. If, however, you are under the age of 25 and you have had a previous abnormal pap smear, you should discuss with your doctor whether you need to have a cervical screening test earlier than at age 25.
All women aged 25 years and over who have ever been sexually active should have regular cervical screening tests.
This includes women who have been vaccinated against HPV, women who haven't been sexually active for a very long time, women who have only had sex with one partner, and women who have only had sex with women.
In our last video, we talked about how HPV is spread. Remember, HPV is an infection that is passed on through genital skin-to-skin contact, so you may still be exposed to HPV infection even without having penetrative intercourse.
So when can you stop having a cervical screening test?
The previous recommendation in Australia was that women have their last pap smear at age 69. This has now changed. A final cervical screening test called an exit test is recommended between the ages of 70 to 74 years.
So for any women within this age group, if you haven't yet had a final cervical screening test, you should see your doctor to discuss this further.
If your exit test is normal, you will no longer need to have any further cervical screening tests, unless of course you develop any symptoms in the future. In that instance, we would recommend that you see your doctor as soon as possible for further assessment.
How often do you need a cervical screening test?
If your cervical screening test is normal, you will be due for your next cervical screening test in 5 years. If you are found to have an HPV infection, you may need to have another cervical screening test in 12 months' time, or you may be referred to a gynecologist for further tests. If you are not yet due for your next routine cervical screening test, but you develop symptoms such as abnormal vaginal bleeding or pelvic pain, we would advise that you see your doctor and discuss whether you need your next cervical screening test earlier than scheduled.
So what are the symptoms of cervical cancer?
If you have HPV, you will not usually experience any symptoms because your immune system will generally be able to fight off the infection before you develop any symptoms. In some people, however, HPV may persist and may lead to changes in the cells of the cervix. Smoking may contribute to persistent HPV infections. If you have early changes to the cells of the cervix, this may not result in any symptoms either. If you keep up to date with your cervical screening, an HPV infection alone or a change in the cells of the cervix would not usually cause any symptoms.
If, however, an HPV infection has led to cervical cancer, you may experience the following symptoms: unusual or abnormal vaginal bleeding, such as bleeding between periods or bleeding after you have already gone through menopause, bleeding during or after intercourse, pain during intercourse, abnormal vaginal discharge, and pelvic pain. It can take 10 to 15 years for an HPV infection to develop into cancer, but as long as you have regular cervical screening tests every 5 years or more frequently if your doctor recommends this, your doctor will be able to detect any changes to your cervix before it turns into cancer and before you experience any of the symptoms that we just listed.
Over the 15 years or so that I have been a doctor, the women who I have seen who were found to have high-grade changes to the cervical cells or who were found to have cervical cancer were women who had not kept up to date with their pap smears. We can't screen for all cancers, but cervical cancer is one of the cancers that we can screen for. And as long as you have your cervical screening test regularly, as recommended by your doctor, any abnormal cervical changes can be detected early and therefore prevent the development of cervical cancer.
Cervical cancer is one of the most preventable cancers. Cervical screening tests are therefore very important in preventing cervical cancer. Make sure that you and your loved ones, whether they be your partner, your mother, your wife, sister or friend, are up to date with their cervical screening tests.
So how effective is the cervical screening test?
Cervical cancer incidence and mortality rates have halved in Australia since the introduction of pap smears and the National Cervical Screening Program in 1991. And now, since the change from pap smears to cervical screening tests, it is expected that this will protect up to 30% more women from cervical cancer. So this just highlights even more how important it is to keep up to date with your cervical screening tests. So what about if you've had the HPV vaccination? Do you still need to have the cervical screening test?
Whether you have had the HPV vaccination or not, you will still need to have regular cervical screening tests. Both Gardasil and Cervarix vaccines only protect you from some of the high-risk HPV types that can cause cervical cancer, but not all of them. Also, if you were already sexually active before you had the cervical cancer vaccine, you may have already been infected by one or more of the high-risk HPV types.
And I think that brings us to the end of part 2. In part 3, we'll discuss HPV vaccinations.
Thank you so much for watching. We hope you enjoyed this video and learnt something new.
If you liked this video, don't forget to like and subscribe and turn on the notification bell to stay up to date with our uploads. And remember, a healthy mind and a healthy body lead to a healthy and happy life. Thanks again for watching.
See you next time.